For our next study, let's go ahead and do both now. For this one, I'll try to get both in. And we'll work our lay-in now. So I'm feeling the pelvic region up and over. So we're bent here a little bit, coming down, feeling that glute. I'm on the back side. And I'll try to find and locate the underneath part of the pubic tuberosity, about running through here, kind of through and above slightly the testicle part of the model, then coming around. And so we feel this box now kind of located here. So if I had to show you the box roughly, that's what I'm thinking about, right in through there. So now coming out gesturally, we'll start to feel the hip pointer or the trochanter out and through and up and over, kind of in through here to get that gesture coming down of our model, right in through here. So there we come down to about where the patella would be, right in through there, and then we're going to bring down the tibia and fibia line coming down and through here. We'll kind of lose it probably out of the camera there. Kind of mark that. There we go. Up in through here and then over. Now we're going to feel the femur come disappearing on the other side of the model on this side, so back in through here and emerge and come over the gesture of all that. So the femur helps with the flow of the gesture. It's not enough just to be the only part of the gesture, but it certainly helps in the beginning. So then we kind of locate now the joint in through here and then come down a little bit further with the tibia and fibia and kind of top out with what will be just the foot's roughly in through there. In that region. So now we can start to pick apart this further. So I'll start to feel now a little bit of the rectus from abdominal area and through here to get to that oblique. Roughly, I'll point it out right in through there. I'm feeling that coming up and over. So this is pretty much a barrel or a tube underneath, oblique and through here. And then coming down, we get the glute over here. We'll just feel that straighten out. Come through and down, and then around. Okay, so we're feeling the bottom of that glute. We get to a little bit now of the flexor and the vastus lateralis over and over. Now I want to feel through the testicle, right in through here where we get the end of the pubic tuberosity and kind of slightly below it. But I'm just going to put a mark in there to kind of feel where this point of our pelvis comes in and over in through there, right? So right in through there, that helps me get the width of all this thigh, the lateralis, the femoris, the medialis, the sartorius, tensor fascia lata, all that coming up and over. And I can kind of feel this coming through and start to feel where the iliac crest is about right in here. You can see it marked kind of lighter on the model. Right in through, I'm barely in camera, but about right in through here, you can start to see it right in through there, and it starts to turn in downward. Then it gets a little shaved and a little bit more pushing through over and through here and around. Okay, and so I'll define it now on the other side, over and back over and through here where I made that mark. That's where that fold of tissue for the belly up and over and through, kind of in through here, so I can kind of overturn that to find that. So even in very thin people have little rolls of subcutaneous fat, so there is hope for all of us, I suppose. All right, so we have that coming down through here and around and over, broke the pencil, of course, up and over and through here now, and back around and over and around to the belly, kind of up and through there, and cuts. So we'll cut that. Okay, so I'll sharpen this up like that. 5, 4, 3, 2, 1, and we're back. Go. So coming through and around now, this belly and through here in the lower part, and then we'll pull around and then we get back to where the testicle right in through here. We can start to put that on a little bit further and overlap that a little bit where that will be. Now we can come down now the leg and cut over here. So that's going to feel, maybe the sartorius is up and through here, coming back on over. Now right up and through here, this little bulgy, see this little bulgy egg-like form area, this is the tensor fascia lata. Part of it in through here, meeting with the rectus femoris, all this up and through this area to give us this kind of bulge, and see how it's around by the crest. So that's how we know what's going on, and the sartorius together too. All that's together, kind of bulging, sort of in an egg form, like so, and then back down around to get the tube of the leg. So the overall form of the leg is kind of a boxy tube. We're kind of backing through here to the glute, roughly over, punch that a little bit. We're getting some tension through the muscle there. Okay, and then we come down now. That's why what we can do further is just to feel the entire shape of it as you were drawing normally without talking to. You'd probably already have this in, so we can kind of come down, feel this over, and say, okay, this is a boxy, tube-like form right in through here, right? Coming down, bulky head. What makes this bulky down through here is the medialis, right? The sartorius, the gracilis, and then coming down in the patella, the tibia coming on down, triangling out, and then we have this biceps femoris tendon. Look how big and straight that is, and it comes on down and curves over, right? Actually, iliotibial tract too, right in through here. That's actually coming over and pulling more along here, and then we get this pulled down, and we get this graceful line of the calf muscle coming through, and then on over this way as well. So we start to see that emerging and coming on down. So as we emerge back over and through here, so now we're on the medial side, but we don't see the abductors because they're inside part of that. So what we're looking at there is a little bit of the sartorius, but fleshy part of the vastus medialis and subcutaneous material cartilage, fat also. And then we're feeling the rectus femoris here, all this over into here, okay? Let's follow it down, and it's going to end, remember, about right in through here and splitting through here. It's not really flexed that much in this particular view, but we have that in through there, so I'll start to make this a little stronger, darker when we get confident coming through here. See how this separates a little bit over, so we can start to just kind of generally glide that on through. And then we come back over the form. Where students make a mistake a lot of times is they'll continue just to outline and forget about the interior forms. And we're studying what these forms are even more. You can do a pretty good figure drawing, actually pretty well without knowing too much of anatomy, but you can't do it without knowing about a lot of form. So here we're getting the biceps femoris a little bit, just briefly back and through here, and we're getting part of that tendon coming down. Then we get the iliotibial tract up and through here, and we're getting a little bit of the vastus and the rectus femoris all kind of conglomerated in through here. They don't separate in this particular view, and so we see this as a major kind of tube right in through here, okay? And then the shadow tells us to come on up here in through and then around. See how bulky and rounded this gets in through here. A little bit of division, and then that's where the medialis will start to come through more down in through here. So you can see just a little bit where it splits off right in through here, right in that little pocket, okay? Coming down and over, and then getting bulkier here, making a move, coming down, and then getting more bulky. And I'm going to stop and then start to come inside the knee a little bit. Now we get where the end of the rectus femoris is here, okay? And the medialis over in here. We get a little more tendinous kind of material, and we get some gathering of fat in our model, even though they're pretty well developed and pretty thin. So we get that in through here. This will start to curve and emerge over and give a little division now, because now we're on the lateral side, so we've got to deal with the iliotibial tract if we have any. In through here, a little toning in through there. So we see that. And so now as we're coming through, we can kind of pick apart this patella region. We got a little gathering of fat, opposite line, coming down and over. Okay, so through that, if you follow where I'm at, over and around, in through here, so we pass the condyle, and then we're back to our T shape of our tibial bone, that tubercle in front there. I'm going to come across and get the other side quickly of where this tendon is, right in through here, biceps femoris a little bit, in between, well, actually tibial tract, sorry. It's actually, this is going to be the lateralis coming over and through and heading out to the sheathing over in through here. And so that's what that is. And then we get the condyle, the fibia, back over through here. The biceps femoris will be on top of that just a little bit, not a whole lot to see. And then we get the gastrocnemius coming over and out and then around. So we see that. So all this is pushing around and around and around we go. And where it stops, we certainly know, because we can draw, right? Okay, that was really bad. So we get that. I'll stop that through here. So now we get fat gathering over the patellar region here. Okay, this little shape. I just essentially draw what I best I can see. Kind of all hell breaks loose out, meaning that it's just drawing what you see through here a little bit. So we've got that, and so we see all this. The patella is roughly encased in all this material, cartilage and fat and bone coming together right in through here. Then we get this over, okay, and around, like so, just following the shapes of it. Then we get the tubercle, and that's tendon. And then underneath that will be a little bit more ligament in through here. So this gets downward tilted in through there. So I can put some stress points with a little darker here, and then here, that coarse shadow of the knee area gently through here. And this is separation of the rectus femoris and the medialis right in through here. Then a little sartorius coming through, and the gracilis on kind of the bottom of that, probably not a whole lot, and through there. And just follow those shapes too now, but you want to know that that's gathering fat material. And through here, the tubercle now, right down in through here where the tendon is located, and then we're going to get this sheathing and turning this way, because the tibia does this now, and it starts to curve and want to come out. Everything is wrapped and now turning around that way. Okay, and so we get a little bit more egg bulkiness up and through here and downward. So I'll just shave that or shade that downward a little bit. Now, right in through here, see this break up? You get what could be, and up through here a little bit more of the tensor fascia lata over and through here a little bit. Okay, this kind of eggs out, egg forms. All this can be a little bit the trochanter in through here a little bit further and over. Okay, and then all this would kind of just go back and shadow right in through there. Can handle that pretty well. And over, roughly through. So I'm going to bring this tendon out just a little bit more there, and just a few darker spots to kind of illustrate it a little bit better. And through here, dark fat material, tendon of the femoris, rectus femoris, and the vastus lateralis through there. That comes to little tension points through here, and a little bit of bulging here, and maybe a little bit of adductor. This little thicker area, but not a whole lot. It'd be slightly underneath. Through and through there. And I think we've got just about what we need now on this side. So let's go over now on the other side over here and keep on trucking. So we can kind of get our shape now back. So I'm thinking of a box or a tube. So I'm just thinking almost even a straight line. Watch this here, and I can come over to here, just to the general part of the patella. And that's not the whole story, but now I can start to play off. We're definitely in the flexor here, right? So that's underneath. Now the adductors are over running through here where I've got my pencil now. So we're over here and back over, okay, coming through. And now we're gonna get to that 3-fingered gap right in through there. See where it's straight? I'm gonna pop it with a little bit more of a red here, okay? That's that 3-fingered gap, which is over roughly right where I've marked it here a little bit. A little bit of shadow and tone running through here to let the leg right in here bend. And so that rectus femoris here is working underneath it, okay, here. And so we'll start to come out now this way. This whole system you can think of as an egg form together, okay? So underneath the testicle there, coming out with the flexors down a little bit, the bulkier head of that semi-tendinous and semi-membranous together right about there. And then they want to flesh and they start to thin out a little bit here and come on down, and I'm a little long with my knee, so now I can start to adjust, bring it in to there underneath, right in through there, so that would give me the angle back up through here. So you got to adjust all the time, so I can bring all this back on in here and over, and this will feel like this with the calf. So I guess I have to feel that back over with the ankle, and then the foot would be roughly back into here. So don't be afraid to adjust always. Always control your scale and your proportion to a better analysis when you get it. So now this is the medialis. Do you feel that right in through here, that bulky part in through here? So we're coming down now here, okay, and then we're coming over. That's the rectus femoris, way on top, okay, that's the very center part, and then downward, and then it's going to get tendinous about right in through here, okay, and then come over, and then the medialis will be on its side. That's where that medial part of that muscle of the leg, right in through there, and it's going to come down and give us this shadow shape, right in through, kind of boxy triangular, right in through. Right in through here to give us that head and over a little bit. Then we get over and see where it ends, the rectus femoris in through, and then we get to the top of the condyle as it starts to make its turn, and then we get to the patella region right there. And that's where that triangle gets reflected light. So we're going to follow that contour there and downward and over, okay? And then the tibia fibia down and through, like so. And then we're going to come over. I'm going to come all the way through, back over now, okay, back over here, and find now underneath here to where the sartorius would get bulky, right in through here. The tendon of the semi-tendinous and semi-membranous back in through here. Okay, we're starting to cook now a little bit, getting it going. Okay, right in through here a little bit. And then this is going to be where that tendon's going to come down and through and in over to the tibia, over in through here. Now up around here we see bony condyle, right in through here. Look how kind of a little circle, oval, especially on the inner part closer to the knee. And through here and over, and then downward. We're going to pull around, and later on this is all going to be right in shadow. Okay. So coming back over here, so we have now, if you'll notice, continuing on, is I'll kind of just put this cast shadow in from his torso on his form here, just to get that located there. And then here, and why that's barreling around, notice you see here how curved it is. So that really tells you through that cast shadow and here how curved overall the leg ends up being. And then we have this wonderful kind of cast shadow, form shadow on the leg here. It's actually form shadow. Right under here, can you see it? This is where the bicep femoris and the semitendinous and semimembranous are, they are separating. So they're moving away from one another in here and splitting apart. So if you go back and remember your diagram, you'll see that. So right in through here, let me make it a little bit clearer with the dark. Right in through here, it disappears and it starts to get more pronounced, roughly right in through there. Let's make that a little bit cleaner and clear. Right in through there, this becomes a form shadow through here, so I'll kind of gently give some contour line expression. But that's where they come to, they split apart. This gets a little straighter here, and when it heads out here, that bulk of that muscle in particular, and come back and over and through, and then they want to form and turn, right, and then come back into the tendon now, back to the tibia in through there. So there's a real strong separation now right in between those forms. Let me put a little bit more form shadow. It's a form shadow, cast shadow, been through here, and you get a little, it's hard to see in there reading, a little bit of the bulkiness right in through here. This turns in through just a little bit, right in through there, coming on over. And so if we move through the femoris now a little bit, there's a little bit kind of a turn here and a little bit of shading tone that we're going to get right in through there. Also the abductors, right in through here. We don't see them a whole lot, but see this little bulge? It's very minimal. Let me put a little bit more shadow here. Right in through here. That's where those abductors are attaching, back and over here too, underneath, but they get buried mostly, so I'll make a little bit more of an issue. When I mean get buried, they get covered up by the position and by other material, mostly skin, fat, etc. Now coming back over to where we are a little bit earlier, this condyle part and through here, right through here, over. And under, and we get this wrapping under. See how this wraps over contour wise, coming up underneath, under through here. Okay, part of the condyle, let's get straighter over through here, so we can see this lock in this position, right in through here. This gets a little bit turned, straightens up, and then comes over like so. And so we get that knee, then we'll feel the condyle in between cartilage and the condyles coming together with that meniscus area, roughly running where I'm drawing now, this little pocket of darker area where they come together, then flatten out, and then they turn away from us, and turn back in, right in through there. And over and through here and around, and we'll get this darkened down a little bit so we can feel that side of that rectus femoris in through here. Sartorius, this little turn signifies the sartorius coming into play more here. It's coming over, but we don't see it here, but we see it more into play here as it comes downward, and right in through here as it opens up, right in through there, and then we'll start to shade some of this over. And through here and around. Even over and then on the patella. Up underneath and around in through here the condyle and over. Pull that in a little bit and around. And we're pretty much now there. I'll just pull this around a little bit. This time you see the tibia here, a little bit right through there. It gets shaded back. It starts to move back to the other part of the leg, and I'll bring out the calf. The gastrocnemius behind there. That tendon will come in front here, the sartorius, and the gracilis right in through here, and we'll get the calf. That will come down and over and head out, and then this little bulge is the gastrocnemius in through here, and then we get the tibia again back over and through here. This gets really narrowed. We get that bone really popping out, so we can make an issue out of the shadow a little bit, and through here more hard edged, and through here up against that bone, and then wants to pop out now to the gastrocnemius of the calf, and through here, and we can just kind of end it right on through there. So let's see, now let's get a little bit more light and value coming across and through here. We can wrap this up nicely. We'll put maybe a little bit of this in through here. Maybe get the top of the pubic areas to separate that a little further. Just coming around the side a little bit. And over. Let's pop a little bit of light, shall we? We shall. Let's hit in through here. So that light source is coming down from the top left in front a little bit. So we get this little bright spot in the top of the condyle. We'll hit that just a little bit right in through there. And then over a little bit, not quite as hot, through here. And on the surface of the abductor. Right through here and over. And then maybe here now on the thigh. A little bit of the glute perhaps, the tensor. And then maybe just a little bit here. This is pretty much already in line, just slightly through there. I think we're set. All right.